for their sexual and reproductive lives. According to the Cytojournal online publication of March 2022, on the article Cancer Cervix, Epidemiology and Disease Burden, cervical cancer remains a major public health problem, ranking as the fourth most common cause of cancer incidence and mortality in women worldwide, after breast cancer, colorectal, and lung cancers. And there are as much as 569, over almost 570,000 new cases every year. It is also the fourth most common cause of cancer death in women worldwide, and it caused almost 312,000 deaths in 2018 worldwide of women. The article also found that globally, 1 in 70 women developed cervical cancer between birth and the age of 79 years. Almost 70% of the global burden falls in areas with lower levels of development. The large geographic variation in cervical cancer rates can be explained by lack of access to effective screening in public health care settings, and further to services that facilitate early detection and treatment. So whereas in the developed world, there's so much access to screening, in lower, well, we are called lower middle income, and then also least developed countries, that access is limited. So already people are cut off from even wanting to see, just like you screen for your health, your general health. So non-existent or inadequate screening and limited access to the standard treatment options that are often unaffordable has led to majority of cases being detected in the advanced stages of the disease in these lower, least developed areas. And then the persistent infection with the high-risk human papillomavirus types, that's type 16 and 18 we are told, is the major risk factor for cervical cancer. Several risk factors for contracting HPV infection and its further progress to cervical cancer has been established. Some of the risk factors are high parity, that is women who have given birth to a lot of children, then long-term use of oral contraceptive pills. I'm saying this with caution. The long-term use doesn't mean that it's the oral contraceptive pills that cause the cancer. That just means that when women are on it, they fail to do dual protection. Dual protection meaning prevention against pregnancy and then prevention against sexually transmitted illness. And so then the fact that you are using contraceptives to prevent pregnancy doesn't mean you are preventing STIs. So that is the association. And so I wish to put it down so that nobody will say, hey, I won't take oral contraceptive pills again. Yes. Then tobacco consumption, and then co-infection with other sexually transmitted agents. Then lifestyle factors such as multiple sexual partners, younger age at first sexual intercourse, and immunosuppression due to some other illness factors. And they are most likely to influence the risk of acquisition and high-grade cervical precancers, and then to invasive cancers, cervical cancer in Ghana. According to a publication in the Ghana Medical Journal 2018 by Nate et al., they found that in Ghana, cervical cancer is the most common cancer among women. Although there's a national cancer registry, cases reported in these registries are based on institutional data from just our teaching and regional hospitals. And therefore, it's not a true reflection of the cancer cases countrywide. There's, however, a global cancer estimation group called GlobalCam, and they have been used based on modeling. They use certain modeling and certain factors to project the incidence of cancer. And based on their projections, they estimated that there were 2,200 deaths from cervical cancer in 2019 in Ghana alone, and 6,699, that's almost 1,700 in 2020. And the new cases of the disease were reported to be 2,009, almost 3,000, 2,979 in 2020. New cases of the disease. So what is the level of knowledge on the public on cervical cancer? I am believing for those who haven't seen what it looks like, we will know. And I'm sure we are all nurses, so maybe I don't want to preach to the or the neck, as we call it. What is the level of knowledge of the public on cervical cancer? Evidence from studies conducted in Ghana indicate that knowledge of HPV, that's the human papilloma virus, and other risk factors associated with the development of cervical cancer is limited. However, studies conducted in well-educated women reported relatively good knowledge of cervical cancer. But these women are generally the ones who are at lower risk of cervical cancer. They know it, and so they are able to protect themselves. So among the general public, it is very low, and prevented and treated. Yes, there are opportunities to reduce the burden of the disease, as we have seen. That's almost 1,700 died in 2020. There's opportunity to reduce the burden of the disease through education, and then HPV vaccination, then screening and treatment of the disease. That's screening for early detection and then treatment. And the integration of public education on cervical cancer prevention, HPV vaccination and screening programs into both medical and public health services is critical in the country's effort to reduce the burden of cervical cancer.
Thank you for watching Nation One TV. Kindly subscribe for more news updates.